Yep, my name is Tim Holt, and it's Timholt.
And Tim, what is your position and where are you at exactly?
So right now, as of today, I'm an associate professor at Colorado State University in the clinical science department in the livestock medicine and surgery.
Very good. And can you tell me a little bit about your work with PAP and high altitude cattle?
Yeah, so absolutely. So early 1980, I just happened to walk into the Four Corners test station when they were looking at high altitude disease. Cattle from all over the country, including Oklahoma, Illinois, were all coming to Hesperus, which is 8,200 feet. And they were coming in there to this Four Corners bull test, and there was this really odd scenario in that after a couple weeks of arrival, these bulls were dropping dead. And somebody happened to just be taking books on it and said, you know what's really interesting is all the bulls that came from Colorado or high country, they were alive. All the bulls that came from low country were dying. And I just happened to be in the right spot at the right time when there were people that are looking into that, and Jim Brinks and Odie and all the people that we talk about being the history. I just happened to be the young person right there. So in 1980, I started studying this disease with this group of individuals, and long story short, I ended up in Gunnison, Colorado, right after undergrad, which was at Fort Lewis, which is why I was in Durango. And I actually worked there for almost 4 years. And I did research on high altitude disease, and I had 2 hyperbaric chambers there where I would take animals afflicted with this disease, take them to sea level via this chamber and treat them and medically treat them. And then most importantly, I started working with this thing called the pulmonary arterial pressure test, or the PAP test that we all know about. And the whole purpose of that was to go into a ranch that was having problems or going to a breeding program and eliminate those animals that were hyper responders. So we call them hyper responders in that when they go to elevation, they're under a hypoxic stress. And hypoxia, remember, means that they have a lack of oxygen into their body. And all of us have that. It doesn't matter if you're sheep, cow, human, goat, pig, or whatever you are, we all go through this hypoxic state in elevation. And we have tracked through the years that response that we have to that hypoxia is very heritable. And so with this PAP test, I started traveling around, and I can remember we made our first calls to ranchers going, can we go to your ranch and can we just try this on your herd because we know that you have some altitude disease issues. And that's virtually how I started, just going and going and going and going. And in about 1982, it began to really take off as a genetic selection tool. So when we do that, we're looking for animals that have a low PAP. So the lower the number, the better the animal is, or the less responsive they are. That's kind of a history.
That's heck of that. And I know, I don't know much about PAP. My family farms out in eastern Washington, so we don't have that issue at all, but that was great from that standpoint.
Perfect.
Is there an EPD, or is there a data point, is there a standardized number or anything that people can compare to?
Yes, and that's a great question, JD, and the answer is almost leading into many other things. So for years and years and years, I just do this. I give the owner a score, he publishes that, she publishes that, and people look for this PAP score, right? And it's all very relevant because you, as a buyer, as a person buying these bulls, you have to look at your PAP score, but then you have to look at all the criteria around that. You have to see where the test was taken, what was the age of the animal. So there's a lot of different criteria that add into that one score. And I have made up charts for people to look at. If this score is done at 6,000 feet, this is what your number should be. So I've given them guidelines for that. And then within the last 2 years, while your question is so good, within the last couple of years, there is a development through CSU, through Lee Leachman, through some other groups that are taking these scores and taking these sires, and they're all relating it, and they're building an EPD now. And so with that number, with the actual PAP and now the EPD, hopefully we're gonna start to develop and change and alter genetics a little bit with that.
And will it be a standardized EPD across all breeds, or?
Yeah, that's another great question. And to be honest with you, that's the mystery right now, because there is no doubt that I see breed differences. And when I evaluate a breed, I think it's really important to know how I do that, right? Because if I'm going to compare Hereford, if I'm going to compare Angus, if I'm going to compare Solaire with Limousin, I can't just compare that broad thing and, oh yeah, all breeds are alike, because they are not alike. So to tell you how I evaluate that is I take 100 head, at least 100 head. There has to be 100 to get into my database. There has to be 100 head pap tested above 6,400 feet and greater than 12 months of age. If I can get that criteria into that nutshell, then I can compare breeds selectively and statistically that I can make a good judgment on that. Because regardless of what we say, I have found high elevation results. I have found animals afflicted with high elevation disease or Briscoe disease in all breeds. I have found animals that have elevated pap scores in all breeds. The only one breed, I should mention this, the only one breed that I haven't found any in is many years ago. I went to Ethiopia at 14,300 feet and tested 325 animals, and the highest pap score I got there was 34. And so they had been there for so many eons and generations, genetically they have selected those cattle out. If you live at that elevation, you go to 17.5, it's not long before it's survival of the fittest. So, did that answer your question?
Yes, sir. Yes, absolutely. We kind of talked off camera there about crossbreeding and that. Do you see that helping? Do you see, I guess, a crossbred calf? Do you see that response? Is there any trends there?
Yeah, there's trends, and I have to be honest with you, that trend is somewhat changing a little bit, and it's hard to describe exactly why it's changing. I can only speculate, but I'm speculating after 38 years of doing this, right? So when I first started seeing crossbred cattle, some of the first ones I ever did obviously were Hereford Angus, right? And I had the Angus sitting here, the Hereford sitting here as far as those that passed the score. And then as we started to cross Angus and Hereford, I saw, wow, this crossbreeding, I'm getting a more low elevation animal developed here. And so the crossbreeding was really bringing that pap test down and helping with stability or resistance to the high altitude effects. And that lasted for a long time, even when the Limb Flex came out and the Sim Angus came out and things like that. The crossbreeding seemed to have really helped. I have seen that plateau off a little bit now, which is not disheartening in effect, because we have so many other traits that we're developing with that crossbreed, right? We are not going to selectively pick one trait to base it off of. I still see that crossbreeding helps a great deal, but there's a lot of different aspects that go into that: heritability, genetics, growth rate, feed efficiency, all that adds up to a higher pap score. So yes, the crossbreeding does help, but it kind of depends on what you're crossbreeding. There's a lot of different parameters that go into that, yeah.
Now, one thing they mentioned today that I didn't ever think about, but for those of us who are in lower elevation, they mentioned in there, and tell me if I'm wrong, that you're finding trends that these cattle that do better in high elevation also are doing better in feedlot and having fewer heart issues. Is that correct?
That is correct, and honestly, that study is still ongoing, and we're doing a lot of that at University of UW. We're doing it at Colorado State, and I'm working with, starting to really work with Clay Center in Nebraska, working on that as well. Because what we want to do is find that out, because we have heard it through the grapevine, sort of, that those animals from high elevation that have low pap scores seem to perform in the feedlot and are not dying of cardiac death. Am I going to go out on a limb and say, oh yeah, every feedlot should only buy that? No, because we don't have that hardcore data to show that. We're speculating that because we know that pulmonary hypertension in the feedlot is becoming a big concern. Yeah, so yeah, this was quite a shock, and it's an honor, and it's totally humbling, right? I mean, I still think today I'm the luckiest person in the world. I have somehow been blessed to have a job that I cannot wait to go to work with. I do not even look at it as my job. I must be my age or my hair or something, because people are now asking me when I'm going to retire. And I honestly tell them, I think I retired in 1988 when I graduated veterinary school, because I don't even look at retirement as an option. I think it's the craziest thing ever that I get to do what I want to do every day. And to get this award for all those years and all that thing, it's kind of overwhelming, and it's extremely humbling, because I have the world's best bosses ever, because when I think of who are my bosses, it's the cattle industry, it's the beef industry. And that's who I work for. And yeah, so it's quite humbling to get that. Deserve it? I have no idea, but I'm very excited. Yeah.
So, I know that there's this winner breeder that you know, Gary Holt, up in Somerset.
Yes.
He got way back bit of a role in the research of analyzing PAP. Is there anything in particular that you might have remembered about those particular cattle about making their breed comparisons?
Right, I think there's a couple things to look at, and I think in the world of PAP, we still have so much research to be done. And one of the areas that I think we should be looking at, and we are, in fact, we're compiling data right now. I have a technician named Lisa, and she's compiling virtually 38 years of data for me. And what we're going to look at is breed differences, and we're going to look a little bit into that because we definitely see it grossly that there's a breed difference. And when I went back many years, we had a lot of Solaris come into Gunnison. I tested for Gary Voke and things, and according to the ranchers and things, they did say and they did witness that they thought the Solaris did better for them, performed better in altitude or not. So when I look and I go, if I could pick research projects, this is the kind of things I'd like to do. I would like to go into the Solaris breed, and I'm going to go, let's test a bunch of them and let's put them to test in altitude. I've even got a study going at UW where we're actually PAP testing yak, and we're moving yak to high elevation, and we're crossbreeding yak. So we're trying to accumulate data, and we're trying to do genetic modulation in that I can put data together with different breeds. And here's a breed that for many years people have said we just don't see the brisket in them. So let's put that to test. Let's do some research on that breed. And same with Limousine. Maybe we get Limousine and we do something with that breed as well. And we actually start to line up and go, is there a breed difference significant enough that I want to choose this breed over that breed? And how do I lower my incidence of brisket through breed selection?
So from the perspective of maybe someone who's not familiar with PAP, let's say you're a Solaire breeder and you want to do some PAP testing and you don't live at elevation. Say
Correct.
you lived in North Dakota but you wanted to take them to, say, Woodland Park, or what type of elevation do they need to be at, and for how long would they need to be there in order to have a somewhat accurate test?
Yeah, sure. That's a great question as well, and and it becomes problematic. And this is, and so it's day one of me doing this. I have been searching for a way to be able to go to low elevation and evaluate an animal, and no matter what elevation I'm at. Unfortunately, to this day, we cannot do that. We don't have a genetic marker that is that accurate yet. We're working on that every day through CSU and some other groups. We're looking at EPDs that will help someone in low elevation. But as far as if you live in South Dakota and you're selling to Woodland Park or Gunnison, Colorado or something, and you want to see how these animals are going to do, we have to create that hypoxic stress of altitude, correct? And I've tried it with gas masks, I've tried it with everything, and it just doesn't work. We have to take the animal out of their environment, move them to an environment in high elevation. And when I say high elevation, that's preferably 6,400 feet and above. We can get by at 5,000 feet, but the accuracy level there is a little iffy. If we can move them to 6,400 feet and above, and we can leave them for anywhere, the minimum I would ever feel good about would be 3 weeks, but I would push for 6 weeks. Then I can go in and I can evaluate those animals, PAP score, their mean pulmonary pressure, and we can go, yes, they are a hypo-responder or they hyper-responded to this elevation change. Then we can predict genetics on that. Is it 100%? No, but it's the best tool that we have to do that.
So if you were a producer in South Dakota and you did have some of those high elevation clients,
Yes.
you could, with a reasonable level of accuracy, bring in a certain number of bulls to be tested at for the time frame you've just described, and with a reasonable level of accuracy, provide them guaranteed type bulls for that.
Yes, and you use the word guarantee. I don't think we can do that, but we can say to them, and actually this time of the year is when I'm doing this a lot. I have people from Nebraska that have moved bulls to Laramie, Wyoming. I have a Red Angus producer that's in Montana at 4,000 feet, and they're coming to Walden, Colorado, 82. And they're bringing in these group of animals, both male and female, that they want to selectively pick those for high elevation. They bring in as many as they can possibly hold there, leave them, I test them, and I say, look, you have all these scored 41 and under, you should be set to go. Let's watch them and see how they perform for you. Or if I have animals that score up in the 50s, 60s, 70s, I'm going, these animals probably should be back in low elevation. Let's not take that risk.
Tim, what did we miss maybe that we're not asking you about?
I think maybe you could ask something like, if you get a high PAP score, what does that really mean? Are there other things that can cause that? Because people need to better understand that physiology.
So yeah, if I brought in 20 bulls and half of them had a high PAP test, what's the next step?
Yeah, so I think that's great. And so when I look at that score, when I have the animal in the chute and I get my measurement there, and let's just say that it's low, I'm going to look at you as a producer and go, this animal is low. That means that at this elevation, this age of the animal, I have this percentage of accuracy predicting that this animal is good for high elevation use. The issue comes when I have a high score. And if I have a high score, and when I say high score, I'm talking anywhere from 48, 49 millimeters of mercury and up. The highest score I've ever had is 215, and that animal actually died of high altitude disease the next day. But I often have animals that score in the 120, 130 region. So there's a pretty significant change there. But when I see that, the unfortunate thing is you two, even as producers, the only thing I could tell you is your animal is hypertensive. So there's other things that cause that, right? I mean, if we have any type of pneumonia, if we have an obesely large animal, if we have GI parasites that are migrating through the lungs, if we have even age factor, there's so many other complicating factors that can cause the animal to be hypertensive. The only thing I can tell you at the chute level is, here is your odds. This animal could potentially be a carrier of hyper-response to hypoxic effects or altitude effects, but I can't tell you that he might just have pneumonia as well. So unless the animal is showing me clinical signs, and only that it tells me that they're in heart failure, I would say to you, because your animal is high, let's get them elevation. Because of the best answer I can give you, I probably would not use that animal in elevation. I would take him back home, use them there, use them, and go from there. Does that sound okay?
Yeah, oh, definitely. Did we miss anything else?
I think, I think that pretty well gives them a broad aspect of it and why they do that. And I mean, I don't think we need to go into too much physiology or anything like that.
Well,
Because
that was my objective, is just to get some knowledge out there.
yeah.
If I want to market a research project to them so that we can sell more cattle, they have to have somewhat of a basic
Yeah.
understanding.
Do you understand the physiology? I mean, you, JD, do you understand the physiology behind a high PAP and why it does that? You want me to briefly touch on that in 30 seconds? Because that's what makes it, right? Okay. You want to ask me or do I just go?
Can you explain the physiology of a PAP?
Yeah, exactly. And so here we have an animal, and we have all these animals at low elevation, and they're standing down now, they're breathing well. This whole physiology, it's called pathophysiology, meaning that the pathology is going to take place as physiology change. And so when an animal, and I'm meaning human, whatever it is, human, bull, cow, gorilla, it doesn't make any difference. When they go to high elevation, there is less oxygen available for us to breathe in. Our bodies, and even you and I and Sherry are standing here today at 5,000 feet, our bodies are picking up that there's less oxygen available to us right now. So the vessels in our lung begin to constrict, and they begin to push blood to other places of our lungs where there is more oxygen. So why fill our lungs in the bottom of our lungs if there's no oxygen there? Our body picks that up and it's going to push blood to areas where there is oxygen, become more efficient. And every animal does that. And so that process is called shunting, where it's vasoconstriction. And we all do that. The problem with cattle, and this is the heritable aspect of this disease, cattle respond to this hypoxia in a massive amount. Me and you and Sherry are standing here and our vessels are doing it at a slow speed. Everything is good. Cattle respond astronomically fast, and they do it in a high degree, and they do it in a permanent fashion. So that's what we're calling a hyperresponder. So those are genetically prone to the effects of altitude do that. And their vessels then get so small because they're just going like this so much that they begin very, very thick, and pretty soon no blood can even pass through them. So all the time, all during this, the vascular space of their lung is constricted down. And so the blood can no longer get up into the lungs, so it backs up into the heart, and it virtually puts them into heart failure. So we're looking at those animals who respond to altitude effects very slow, very controlled. And we're trying to find those that respond hyper, where their hypertension goes really, really high because their vascular system is closed down. That's what we're trying to eliminate.
So the common name for it, I think, out in the industry is brisket disease.
Yes.
Why do people call it brisket disease?
Yeah, and that started, so I've heard it called brisket disease, dropsy, sudden death syndrome, ascites, all those things, but the common one is brisket disease, because an animal that actually has altitude effects or bovine high mountain disease or brisket disease, stands with its legs out like that, trying to let it to breathe. And this hypertensive state that the heart's creating is so high, it's actually pushing fluid out of the vascular space. So the red blood cells stay within the vessel, but the fluid in our blood squirts out. And where does it settle? It settles in their brisket. And the briskets get bigger and bigger and bigger. If you've ever been pregnant, JD, you and I probably can't relate to this, but the same thing happens to women, and their feet swell up because the blood can't circulate really well because they have this fetus in them. It's the same type of scenario. Did that help?
Yeah, that did.
Yes.
I want to know why it's called brisket.
Yeah,
How do
boom.
they know?
Yep.
Yeah. Anything else?
I think that covered a lot of it.